So let's have a look at how we collect client information. This is very important. From the information you collect, this is how we make sure we write the correct program and monitor clients appropriately. By the end of the lesson, you'll be able to identify appropriate methods for screening and gathering information and gaining informed consent to exercise. You'll also recognise different risk stratification models. These help to assess the risk of each client, make sure we act appropriately, and identify appropriate methods for recording and storing client information. Also, if you need to refer to other professionals that go beyond your scope of practice. So firstly, have a think about what information you might want to collect about a client. Just get a blank piece of paper, write down anything you think. You can talk to other people on the stream if you want. You might have come up with things like this, so medical history, and this we help to screen people. Screening means in or out, you're either fit enough or not. Informed consent, so have they agreed to exercise? Any personal information, address, date of birth, doctor's information if required, any lifestyle information on diet, sleep, exercise history, etc. Motivational and exercise preferences, what they like to do, anything they don't like to do, what makes them motivated. This can lead to the reasons why they're exercising, and then assessing their current levels of health. So by doing all this, you've got a good basis on which to make a good plan. So have a think about why it's important to collect client information. These really are to underline any medical conditions, identify the needs for referral to another professional, give information, make sure that information that is provided is appropriate to that client. All right, so we're giving the right guidance for their appropriate exercise intensity and challenge. Make sure it's ready for their goals, and make sure it's aligned with their likes and dislikes. So particularly for people new to exercise, giving them things they like to do does help them to drive what we call adherence. Also, you get a chance to build rapport between you and your client and get used to working together. So have a think about how you might gather information. There are advantages and disadvantages for each method. Have a little write them down if you want to chat about it, if you can. So you might have come up with these. So you could use questionnaires, which are structured questions that are usually written down. You could have come up with an interview, physical assessments such as blood pressure, and observation. Let's go through them one by one. So for questionnaires, the advantages for questionnaires are generally quite quick to complete. You can often send them out to be done in the client's own time. You've got a written record then of what was said and what information you're working on. So if there's any issues later on, you can point to that. They're generally recognised as valid and reliable, and you can update them as you go along, and then generally the information is there immediately. Potential disadvantages: sometimes language barriers can get in the way. It doesn't give you the chance to further probe the client. So what did you mean by that? Tell me more. The information might be out of date by the time you get there, particularly with acute conditions. Some require permission for use, and then obviously you need some time then to read and respond to the answers. But generally questionnaires are a fairly reliable way of getting base information, particularly the type of thing you need to get off anyone to screen them. An interview has different advantages. You can now use open-ended questions. You can get a lot more soft information in that way. It's much more personal, so you're generally able to establish trust, build rapport better. There's opportunity to clarify and encourage and elaborate on anything the client says. Downsides are potentially time-consuming. Difficult to record all the information accurately and have a conversation at the same time, and in a way that you can go back to your notes and use reliably. Does require kind of empathy and effective listening skills. Some people have these more naturally than others, but you can learn and practice them. And then there is risk of disclosure of information outside of role boundaries. Sometimes you can end up being tempted to give medical information when that is beyond your role. In an observation, this is quick and immediate and gives quite good information on gender, age, posture, body composition, things like your walking gait or your squat form, for example, facial expressions, skin colour changing during CV activity. So often we'll do observations of certain types of fitness. Disadvantages is sometimes it can be inaccurate, and sometimes it's not as effective as it might be in things like lifestyle behaviours and medical conditions. You can't actually see those things, but what you can do is see how they walk, see what their body composition is, etc. Lastly, physical assessments can provide baseline information that can form both program design and safety constraints, provide objective information, can identify medical contraindications, so any exercises they're not allowed to do, and can be retested, and this can show then progress. Disadvantages: you will require informed consent, so there's an extra layer to go through. Some of the tests, particularly things of strength and power, maximal endurance levels, will be risky in themselves, so you kind of have to weigh up whether the client is safe to do it. Some can be invasive, such as body composition testing, skin fold testing, etc. Sometimes the equipment is costly, and obviously you need recalibrating, updating regularly. There is a human skill component with the accuracy of the tests, so the better your training, the more practice you get, the more accurate you'll be. And there is a time element to these which can be restrictive. So have a think about all those and then weigh up the different advantages and disadvantages. Obviously you can use a combination, you don't have to just stick to one. So if we wanted to follow that through, you can have a go at this. So have a go at designing a questionnaire. What kind of interview questions would you like to ask, either in questionnaire or interview? And then if you can role play with someone, you can see whether you got the information you required by analysing it and see how effective it was in driving information towards your program. Let's have a think about informed consent. And the way to think about it is to think, what information would a person need to know about an exercise session or fitness assessment to be considered informed? All right, so obviously you should always seek consent to participate, but if a client doesn't know what it is they're participating is, they can't be said to have had informed consent. So these kind of things come under informed consent: an explanation of the potential risks, discomforts and benefits. So for example, if you're rowing, you can say this does make you cardiovascularly fitter, but it can be uncomfortable if you train at high intensities. It can be an issue if you've got a heart condition, for example. A mandatory document obtained before fitness test or exercise participation. So mandatory means compulsory, you do need to make sure you do this. The client must understand that their participation is entirely voluntary and given the opportunity to ask questions. Right? So they must be consenting. If they don't consent, they won't exercise. The consent is mandatory, the exercise is not. One of the many records that can be produced in a court of law, and informed consent can only be given when certain information has been explained by the instructor. So it won't hold up if they've only been given information in a technical way or a way that's not accessible to them. This leads us nicely on to risk stratification. So obviously when you're working with people, you want to make sure we're working with people at appropriate risk level. So we need some way of assessing who might be a higher risk. If someone's of a higher risk, they may need to be trained by someone who is of a higher technical ability or has more specialist skills. Okay, so we do use a number of risk stratification tools. So to ensure that we can work within your scope of practice, we must risk stratify the clients. At level 2, you should be working with low risk people. And so therefore, if you've established their low risk, they can then become within your scope of practice. So there's a number of different tools it's worth becoming familiar with. So one of them is the NQFA pyramid. There are two, and the Irwin and Morgan risk stratification. So I'll put this link into the document, and you can follow that. And there's also some stuff on page 10 and 11 of your manual. Just discuss some of the ways of risk stratification. So if your risk stratification becomes quite high, you may feel you need to medically refer people or refer people outside of your scope of practice. So if the risk stratification comes down low, you're able to take that client and do what you do with that client. If, however, it comes that they are higher risk, you may then need to send them to somebody else who has appropriate qualifications. So if they have a higher health screening response, if they've got a number of factors, so this could be a BMI, smoking, and a high blood pressure could lead to combined risk factors. Injury or illness, if you're not sure or you're uncertain in any way, it's always better to refer, and if the client is any doubt and would like some reassurance, they should refer, and also being of a high age. So if someone is out of your scope of practice, these are a number of things you could look at. GP as you go to, they can refer to other places. Dietitian for diet stuff, physiotherapist or sports massage practice, or osteopath for injuries, counsellor for mental health issues, pre and postnatal for pregnant ladies or postnatal exercises, strength and conditioning specialist for those sort of goals. There are a number of level 4 specialists in conditions, for example, obesity and diabetes or low back pain. So here's a little exercise you can do. Just write down why a client may not participate in exercise and who they should refer to and why. If we talk briefly about recording, we talk about this elsewhere as well, but paper should be kept in locked files. Electronic records should be securely done with passwords. You shouldn't disclose any client information for third parties. Information must be transferred securely when it's transferred. You must inform your clients what any information is intended for and only use it for that purpose. Once you finish with the information, you can dispose of that. As a general rule in fitness, that's 8 years, and when they are disposed of, they must be disposed of securely. So you should now be able to identify appropriate methods for screening and gathering information for clients. You should be able to recognise risk stratification models, and you should be able to list appropriate methods for recording and storing information, and also what other professionals you may look to go towards if something is outside of your scope of practice.